This is All India Radio Mangalore. Dear listeners, in today's Talk in English program now, Dr. Ramesh Bhat M, a consultant dermatologist, professor and vice dean, Father Muller's Hospital, Mangalore, currently the WHO expert on tropical diseases specially related to skin and international director for International League of Dermatology Society, speaks on the topic Dermatophytosis or common fungal infection.
As you all know, the fungal infection, the so-called ringworm, is one of the common manifestations that we see in our day-to-day life. And nowadays we are seeing more number of cases of these ringworm or superficial fungal infection. I will be discussing about this common fungal infection. Scientifically we call it as dermatophytosis or commonly as ringworm because of the round itchy red patches which is a common finding in this disease. It is a type of infection caused by group of fungi called dermatophytes. It not only affects the skin but also the hair and nail. In view of the high humidity, it is very common in tropical climates, especially in places like Mangalore where we have very high humidity. So this infection is quite frequently seen during summer months and also during rainy season. We call this as dermatophytosis or in common word ringworm. They are highly contagious. It spreads from one person to other person through skin to skin contact, contaminated objects and surfaces, and also the clothes. The skin changes may sometimes become widespread, involving the visible areas of the body, significantly affecting the quality of life because there will be very severe itching and it may annoy the individual, especially when they are exposed in the community. Until a few years ago, dermatophytosis was treated very easily using antifungal agents. It may be either in the form of creams or in the form of tablet. In the recent past, we have come across a baffling change, especially for the last 1 decade or so, failure of adequate treatment response to antifungal agents. It has led to an emergence of almost like an epidemic situation of chronic and recurrent fungal infection or the dermatophytosis in India. This is mainly because this condition is not just managed by dermatologists alone. Many patients first report to their family practitioners or sometimes to other specialty doctors, pediatricians, physicians, unqualified quacks, and because it is on the skin, many a times our people go and buy creams from the pharmacists who have inadequate information about the treatment. Many of them, especially in medical stores, give creams like Quadiderm, Dermify, Foderm, Betnavate C, Clopgeum, which contain mixture of creams with high potent steroids which result in not only resistance but side effects like stretch marks, thinning of the skin, increased hair growth, pimples and bacterial infections. It is important to note that all these creams containing steroids are Schedule H drugs and should be dispensed only with the prescription by a registered medical practitioner. But our pharmacists usually give this as a over-the-counter medication. When you go and ask them, they will simply dispense this medication, which is wrong. In fact, when I was the national president of Indian Association of Dermatologists, Venereologists and Leprologists in 2018, our public interest litigation was honored by the Delhi High Court and later by Government of India, who made this change. That is, you can buy these creams only if there is a doctor's prescription. Coming to the various factors which are responsible for this fungal infection, host factors such as the site of infection, barrier function, age, obesity, immunosuppressive state, diabetes, use of topical steroids or other immunosuppressive medications may affect the spread of infection and clinical presentation. In India, presence of hot and humid climate, and in some places it may be because of the socio-economic status, overcrowding, sharing of infected clothes and footwear, poor hygiene and migration of population may produce this fungal infection and predispose to recurrence of this dermatophytosis. Most non-hairy infections are characteristically show ring-like reduced scaly lesions with active spreading and inflammatory borders. That's why it is popularly called as ringworm of the skin. Hair areas often show more inflammation, often due to the invading fungus. Extensive disease, uncharacteristic presentation or the atypical presentation, and the extension of the disease into the scalp and face have become very common nowadays. The appearance of the lesions at the site of the rings, drawstrings, wristbands and body threads worn for cultural and religious reasons may serve as reservoir of the infection. It is also quite common in people who wear wet clothes or even tight clothes. The diagnostic difficulty has been posed in the recent past with the emergence of atypical dermatophytosis. That is, the manifestations are not very typical, and many a times even the doctors or the dermatologists fail to make a proper diagnosis in those cases. Majority of the such presentations is attributed to the usage of over-the-counter mixture creams, as I've already told the names also, the Squadiderm, Dermify, Foderm. Please avoid these creams. These creams can give quick relief. The moment you apply, there will be alleviation of the symptom, but the disease slowly gets resistant and it will rapidly spread with the atypical presentations, persistence and widespread infection. Rampant use of such creams has immensely contributed to the current fungal infection. The topical antifungal therapy is safe for pregnant, lactating women, infants and small children. So when you visit a doctor, when the cream containing a pure antifungal medication is given, there should not be hesitancy to apply among this group of patients. Apart from treatment, prevention of recurrences, reinfection and spread to family members and contacts is important. The important aspects include hygiene, avoiding the steroid containing creams or whatever the mixture creams that I have mentioned, and treating all the contacts. It is very common to notice that many family members are simultaneously affected in the current scenario, which causes economic burden too. Many a times, these lesions are seen mainly in the covered parts. It may be in the inner side of the thighs, or it may be in the armpits, or especially in women below the breast. So, many a times, people hesitate to take the proper treatment. This is also a reason for suffering which will profoundly affect the quality of life. It is important to note that prevention is the key to avoiding fungal infections. There are a few general measures you can take to reduce your risk of getting fungal infections. Regular bath, wiping of the body dry, regular laundering of the clothes, washing and storing clothes and blood linen separately from others, avoidance of sharing of clothes, towels and soaps with others, avoidance of wearing bands, threads, drawstrings, rings, avoidance of infected materials to reduce recurrence, losing weight, especially in obese individuals. These are some of the very important preventive measures. All these will reduce the chances of the fungal infection in groin and other intertriginous areas. It is also very important to note that it is better to avoid contact with pets if they have got infection. The application of corticosteroid containing creams or the mixture creams, avoiding walking barefoot in public areas such as gyms, locker rooms and swimming pools are also very important steps. And more than anything else, completing the course of treatment, it ensures the complete cure. Treatment of other infected house members and close contacts helps in preventing recurrence of the infection. There is a new drug-resistant species emerging in the community, which we can call as a fungal superbug, which is responsible for an almost epidemic-like situation, not only in India but also in other parts of the world, especially in the tropical countries. I would like to highlight the various precautions and preventive measures to combat this ringworm or fungal infection or dermatophytosis. One is avoidance of tight and wet clothes, proper personal hygiene, the prevention of exchange of clothes. It is also important to consult a doctor, preferably a dermatologist in the early phase of the disease itself. It is also important to treat all the affected members of the family. Avoid taking over-the-counter creams from medical stores or suggestions from others like your friends. It is very important not to apply mixture creams containing potent corticosteroids. I have already mentioned the names also. And it is also important to take complete course of treatment. In conclusion, dermatophytosis is a common fungal infection. Most of the time it can be easily diagnosed and treated with proper management. While it can be uncomfortable and unsightly, it is not a very serious health threat, but at the same time it will affect your quality of life. By taking the necessary precautions and practicing good hygiene, you can reduce your risk of getting fungal infections. So always keep your skin clean and keep away from fungal infections and other infections. Swachh Bharat with Swachh Twacha.
Dear listeners, you have just had a talk on dermatophytosis or superficial fungal infection by Dr. Ramesh Bhat M, a Mangalore-based consultant dermatologist. This talk came to you from the studios of All India Radio Mangalore.